Let's go on study part 2 about the disease of mood disorders. Why the patients have depression or mania? Actually, the exact cause is still unclear. We just have a main hypothesis partly explained why some drugs are effective to control these symptoms. All in all, the patients with depression, usually the function of amine neurotransmitters is not enough. And the patients with mania, it is just the opposite. Their amine neurotransmitters function relatively overexcited. Okay, let's first study antiemetic drugs. The hypothesis for mania, it is amine neurotransmitter hyperactivity. Actually, the exact mechanism of mania, it is unclear. But the patients with mania, usually there is excessive activity of amine neurotransmitters, including norepinephrine, dopamine, and serotonin. This hypothesis is supported by catecholamine-like activity tend to exacerbate mania, and drugs which decrease the activity of amine neurotransmitters can relieve mania. The drugs of antipsychotic drugs. You have studied phencyclidines like chlorpromazine. They have calming and depressant effects in controlling all kinds of mania, but they do not normalize behaviors. Lithium salt. Because of the overactivity of catecholamines in manic disorders, this drug is effective in the treatment of mania, but compared with phencyclidine, it's better because this drug can decrease severity of manic phase and lengthens the time between the cycles. At the beginning of this chapter, when I introduced mania, I mentioned after episode of mania, the patients usually have an intermittent remission period. During that period, the patient seems normal. So this drug can lengthen that time between the episodes. And lithium salts also counteracts mood changes without producing sedation. This is different from that of phencyclidines. Why lithium salts are effective in the treatment of mania? Because it can displace calcium, because it is a kind of energetic salt, so displace calcium and decrease the excitability of the neuron cells. It also reduces norepinephrine and dopamine release, so decrease the function of amine neurotransmitters in the seeing eyes. And it also promotes synthesis of acetylcholine, increase the function of dopamine cholinergic pathway. And it also promotes reuptake of norepinephrine and promotes its metabolism. So it promotes the inactivation of neurotransmitters, amine neurotransmitters. So the availability of norepinephrine as a neurotransmitter is reduced by lithium salts. Lithium salts is the only specific antimanic drug for the prophylaxis and the treatment of bipolar disorder. I mentioned bipolar disorder means some patients have mania and depression. Just they have different episodes. This drug is very effective, especially in the manic phase. But notice, lithium salt has relatively narrow safety margin. Other antimanic drugs. One is valproic acid. This agent can be worked as the first-line treatment of mania. And carbamazepine. This also is effective to control acute mania and used for prophylactic therapy. It is okay. Maybe you are familiar to these two agents you have studied because both of them are anti-epileptic drugs with broad spectrum. Okay, in this part, lithium salt are a new drug for your study. It is just mainly used to control the manic phase. So in the treatment of mania, lithium salt is more important. So what drugs can be used to treat depression? Let's go on study. Part 3. Antidepressants. Based on the hypothesis for depression, amine insufficiency, the patient with depression usually has an inadequate amine neurotransmission and reduced amine neurotransmission. The drugs, antidepressants, usually they can increase availability of amine neurotransmitters. So the way for increasing amine neurotransmitters of antidepressants by reuptake inhibition, negative feedback inhibition. Now first is non-specific reuptake inhibitors. These drugs mainly are tricyclic antidepressants. This also can be called by TCAs. Imipramine is the representative drug in this group. And meprotilene, it also is non-specific reuptake inhibitor. TCAs can block the reuptake of norepinephrine and serotonin, and then, it can prolong their action because the reuptake of these neurotransmitters is the primary way for their inactivation. And these TCAs also can block alpha-1 receptor and M receptor in the peripheral tissue, and this mainly contributes its adverse reactions. TCAs can produce a gradual alteration of a selected central adrenergic, serotoninergic, and dopaminergic receptors. Just now I mentioned imipramine is the representative drug of TCAs, mainly depending on blockade the reuptake of norepinephrine and serotonins. This drug, after administration, the normal subjects usually show some symptoms like drowsiness, feeling difficult in concentrating and thinking, and hypotension. But for the depressed patients, after using this drug, imipramine can elevate the mood and increase alertness and improve appetite and sleep. So it is commonly used to treat depression, including endogenous or menopause depression. As with many of antipsychotic drugs, the TCAs also produce autonomic side effects by blocking M receptor and alpha-1 receptor. Some TCAs also produce marked sedation. This drowsiness also is one symptom of sedation. And in the treatment of the depression, This drug usually takes on-site after repeated administration for 2 to 3 weeks. Because of M receptor blockade, it also can be used to treat enuresis. And it also used to treat anxiety and phobic disorders. For the anxiety, when I taught you sedative and hypnotics, I mentioned some TCAs of antidepressants. They also are commonly used to treat anxiety. And I also mentioned the patient with anxiety, if that anxiety is very serious, without drug therapy, finally, this disease, anxiety, can develop into depression. Because of M receptor and alpha-1 receptor blockage, imipramine also has some adverse effect on ANS, like tachycardia, hypotension are relatively common, and like blurring vision and dry mouth. This agent, fluvoxamine, it also can increase the serotonin levels and improve the symptoms of depression because it can inhibit the serotonin reuptake in synaptic cleft. So it can increase the serotonin concentration. This is the mechanism of its action for the depression. Paroxetine, this drug, it also can inhibit the serotonin reuptake. So used to treat depression with anxiety and social phobia and obsession. The reuptake of amine neurotransmitters is the main way for their inactivation, but also some neurotransmitters of amine depends on metabolism by some enzymes. So monoamine oxidase MAO inhibitors also can increase the amine neurotransmitters concentration. Irreversible MAOA and MAOB inhibitor like phenelzine and reversible MAOA inhibitor meclobemide. This drug, they can inhibit this enzyme, so delay or inhibit the metabolism of amine neurotransmitters. They are also effective in the treatment of depression. Atypical antidepressant. Mirtazapine. This drug, based on the blockade of alpha-2 receptor, this also increased the serotonin and norepinephrine amine neurotransmitters in the CNS. Because this alpha-2 receptor in the presynaptic membrane, it is always related to the negative feedback of regulation in the negative feedback of regulation of neurotransmitters release. So once it is blocked, it can increase these neurotransmitters. Okay, that's all for this chapter. There is a summary of psychotropic drugs. This part include antipsychotic drugs, antimanic drugs, and antidepressant drugs. Antipsychotic drugs are more important, and there are so many agents used to treat psychosis, especially schizophrenia. And Chlorpromazine, it is one agent of phenothiazines. It is the representative drug of antipsychotics. Salcizine, it is the agent of salcizines. And haloperidol, it is the representative drug of butyrophenones. And clozapine, it is the second generation of antipsychotic drugs. It mainly blocks dopamine 4 receptor and serotonin receptor. Chlorpromazine, it can block dopamine alpha and serotonin and histamine receptor. So based on this blockade of receptors, so what are the pharmacological effects of chlorpromazine? Do you still remember? Because there are several dopaminergic pathways, all can be blocked by chlorpromazine. This drug has obverse effect on CNS. And the blockade of alpha and amine receptor, it also has effect on ANS. And dopamine 2 receptor, dopamine 2-like receptor blockade, it also has effect on endocrine system. And blockade of serotonin receptor and histamine 1 receptor also contribute to the effect of CNS. On the CNS, chlorpromazine induce antipsychotic effect and antiemetic effect and inhibition of hiccup. It also has effect on the body temperature regulation. That alteration is according to the environment temperature. It also has potentiation of other depressive agents. Based on this effect, chlorpromazine usually used to treat what disease? Remember? The first one is schizophrenia, but note, mainly used to treat type 1 schizophrenia, to relieve positive symptoms of schizophrenia. It is very effective. For the acute schizophrenia, it is more effective. Used to treat nausea and vomiting caused by some disease or drugs. It also is very useful. But notice, for the motion sickness, it is invalid. And usually, the second generation of antipsychotics has no antiemetic effect. Because this drug has potentiation on the other depressant agents and also can decrease the body temperature with the physical cooling. So it is usually used for hypothermic anesthesia and hibernation therapy. And based on this receptor blockade, this drug induces many adverse reactions, especially effects on the CNS in the treatment of schizophrenia. It usually requires a long therapy, so it will induce some classic EPIs, extrapyramidal symptoms, include 4. Do you still remember? What are they? PD syndrome, acute dyskinesia, and akathisia. acute dystonia, and akathisia. These are early reactions of EPIs. A late occurring syndrome of abdominal chloroform movement is tardive dyskinesia. Tardive dyskinesia it is irreversible, but PT syndrome and acute dystonia and akathisia can be controlled by anticholinergic drug or by decreasing the dose of chlorpromazine. It also is useful. Antiemetic drugs. In this chapter, you mainly study lithium salt. By decreasing the activity of catecholamines, lithium salt can be used to treat mania. Antidepressant drugs. In this part, you mainly study TCAs, especially imipramine. This drug, by blocking reuptake of norepinephrine and serotonin, it used to treat depression. Okay. This table, it also is drug summary of antipsychotics and lithium. I think it also is helpful for you to review this chapter. There are several questions, and look at these questions all are about chlorpromazine. So here, I think you know this drug is really important in this chapter.